Welcome to PodcastRx, a production of Diamond Pharmacy Services. This is a show about pharmacy, but don't let the title fool you. While we definitely talk with pharmacists about medication topics, we also sit down with nurses, technicians, and other pros to discuss relevant issues in corrections health, long-term care, and so much more. Whether you're a pharmacist, a practitioner, or just find these things fascinating, this is a show for you. On this episode,
be honest. When you saw the title of this episode, did you let out a sigh? Or maybe roll your eyes and think, they're talking about COVID again? Well, we understand. No matter what degree the pandemic has affected your life in the past year, it's more than safe to say that you're tired of it. You're sick of it. And you probably felt that way just weeks into the pandemic, let alone months and now a year. Of course, pandemic fatigue is more than just annoyance or inconvenience. It's a phenomenon that can have serious effects on public health. Diamond Infection Control Coordinator Debbie Yackuboskey returns to talk about pandemic fatigue, how it makes us feel.
You can see the burnout on several levels. You can see that on a physical level. You can see it on an emotional level, a psychological level, a spiritual level.
The toll it's taken on healthcare workers.
We as human beings are not programmed to deal with death after death after death after death, day in and day out.
And a few practical tips for living with it.
You need to disconnect, and you need to get back to your inner self, and you need to look to see what makes you happy.
And we also talk about what the future holds, and when, perhaps, we can all rest a little easier. You're listening to PodcastRx. I'm Adam Campbell. We'd like to welcome back Debbie Yackuboskey to the show. She is a registered nurse practitioner, nursing consultant, and Diamond's Infection Control Coordinator. You might remember her from episode 13, COVID-19 Preparation and Adaptation. Debbie, thanks for lending us your time once again.
Well, you're very welcome, Adam, and thank you for inviting me back.
Absolutely. Now, in that previous episode, you gave us a glimpse into the many measures that you had to oversee to protect Diamond employees and Diamond customers from COVID-19. As we record this, it's almost a year since the start of the pandemic. And I think you can agree with this. It's been a very long and tiresome year. I say it that way to segue into today's discussion about COVID fatigue. So let's start with the basic definition. How would you explain COVID fatigue to our listeners? And just a quick note, we could also call this pandemic fatigue just to avoid any confusion with actual disease symptoms.
Right, absolutely. You said that very well, Adam. It is simply burnout from the pandemic. We have been dealing with this since the beginning of 2020. We thought that we would see an end in sight by the end of 2020. We are now into the end of February of 2021, and we are still dealing with it. And as human beings, we are not programmed to deal with pandemics, and we are not programmed to deal with issues for a prolonged period of time. So we're getting to the point where we're seeing that burnout from people. And you can see the burnout on several levels. You can see that on a physical level. You can see it on an emotional level, a psychological level, a spiritual level. And there are symptoms to all of those. But more importantly, you get to the point where human beings feel like they can't control what is happening around them. And when they've lost that control, then you start to see people kind of push back on some of the health measures that are out there that we're asking folks to do in order to mitigate the COVID-19 virus that we're dealing with. So, when you're talking about the burnout, like I said, you're talking about it on both one level, but on another level, you're talking about people just starting to become resistant to what we're asking them to do. So there really are two levels to COVID fatigue.
What are some of the more specific symptoms of this burnout?
I think, from an emotional level, we get to the point where we've been inside for as long as we have. we may be an individual who has been working from home for over a year now. We can't really get out and socialize. I mean, human beings are social animals and creatures, and we can't socialize like we used to. So we have that level of boredom. We have that level of loneliness. We're sad because we may be cooped up in the house and unable to do what we are used to doing. There's that level of frustration because we are no longer in control. We are not driving what we're doing in our world around us. There's that level of anxiety because people may have lost their jobs. They may have lost their homes. They may be dealing with COVID-related illnesses. So you have that level of anxiety. You have fear because of the fact that if you haven't dealt with the COVID, there's always the fear that, am I going to be the next one to get COVID? Is a family member going to be the next one to get COVID? Resentment, because I know early on we heard a lot of pushback and a lot of resentment with just mask use, for example. It's my right not to wear a mask. It's my amendment not to wear a mask. It's my choice not to wear a mask. So we heard a lot of resentment because we were being told what to do. And then just helplessness because of the fact that we don't know what to do. Things have changed every day. I mean, being infection control coordinator here at Diamonds, what we did at the beginning of the pandemic is not what we're doing now. Mm-hmm. The mitigation efforts that we did earlier on are mitigation efforts that we may not be doing now. And information changes so rapidly throughout the course of the pandemic. And people are so tuned into all of that information out there. Some information is good, some information is bad. Mm-hmm. So it's difficult to kind of weed through that to see truly what is the helpful information that we should be following at this point in time. And I think that to some degree, we have lost the life that we know, obviously, and the social relationships that we had previously. And we've tended to be more core with our own family at this point in time. And, some families do really well with that. Some families don't do really well with that. Right. But from physical symptoms of what people may encounter because of the COVID fatigue, a lot of tiredness. If you've been battling with, even the disease itself, the virus itself, or even just been battling, trying to do what you're supposed to be doing for over a year now, you're tired of it. You're weary. You've got that fatigue. Some people evolve into having psychosomatic symptoms. They have emotional issues, but they're coming out as physical symptoms for them, where there's no real underlying medical reason at that point in time. Inability to complete daily tasks. Some people get to the point where they are just so depressed and they feel so helpless and hopeless that they can't even just get up and do the events of their normal day any longer. Increased irritability with what is going on around us. Decreased work performance, oftentimes, because it's just dragging out as long as it has. The isolation, I think that's a big thing for folks, especially if they're working from home, living from home, living at home without anybody in the household with them. A lot of isolation at this point in time. Mental symptoms, stress, anxiety, worry. If you've lost your job, or if you're underemployed, or you're on the verge of losing your household, there's a lot of worry in that. If you can't put food on the table for your family, there's a lot of worry and anxiety with that. A lot of fear, a lot of depression. One thing that's evolved out of this pandemic as well has been increased alcohol and drug use because of it. It's just a way to escape from what is going on around us. So there's a lot of things that have come out of this, and there continues to be a lot of different symptoms that are evolving as time goes by.
Yeah, this is a beast with many heads that affects people differently, festers in different ways. And I wanted to ask you, Debbie, as the COVID fatigue deepens, I mean, we are approaching the 1-year anniversary. And of course, the U.S. just passed the very grim milestone of 500,000 deaths. With all this in mind, as a nurse practitioner, do you have concerns regarding mental, physical health from a long-term standpoint? Just how is this pandemic experience going to affect people down the road?
Absolutely. Just because we are able to get COVID under control, and just because we may be able to, start to return to some sense of normalcy, I think we're going to see the long-term effects of this for years to come, especially with the psychological and the emotional issues. Somebody who was already battling depression, already battling anxiety, and may have been already receiving health care for these types of issues. When you have a pandemic is going to escalate the symptoms for that individual, possibly escalate the amount of time that is needed to deal with the depression or deal with the anxiety, may increase the medication use that's needed in order to control the symptoms of some psychological issues. And those are not going to go away once the pandemic is under control. This is something that individuals will probably be working on for some time yet. And like I had alluded to earlier, we're not probably going to see an end to this in 2021. We're probably going to be more into 2022, possibly 2023. And we're going to find that there's going to be, and I hate the term, but I'm going to say it, a new normal. Mm-hmm. Okay, we are not going to be able to return back to what we did pre-pandemic. There's got to be some changes moving forward. And how individuals adapt to those changes, as we as a society adapt to those changes, time will tell. It'll evolve, and we will have to evolve with it. And unfortunately, we've got like 3 variants of the COVID-19 virus out there right now. Mm-hmm. We don't know that much about those variants. We don't know if the vaccines that are available to us at this point in time are going to cover the variants. We don't know if additional variants will emerge. So there's still a lot of unanswered questions with regards to COVID-19 and moving forward.
And of course, fear of the unknown is one of the most potent fears that we as a species have. So that only adds to
absolutely
and contributes to the issues that we're talking about.
Absolutely. And as we move forward, and we are talking about COVID fatigue today, we're over a year into this now. Okay, if we go into 2 years, maybe 3 years, can you imagine what the fatigue level is going to be, what the mindset's going to be, what the psychological and emotional health of individuals is going to be? I mean, we have a certain percentage of the population that has psychological and emotional issues now. We are getting newly diagnosed individuals with psychological and emotional issues because of the pandemic. So I can just kind of see this snowballing if the pandemic continues to go on.
Yeah, certainly. I do want to ask you later on, and as we get through our questions here, I do want to ask you more about the quote unquote new normal, and we'll certainly come back to that. But with all of that in mind, with everything we just talked about, the physical, the mental manifestations and situations, and what are some of the easy ways and easy things we can do to help combat this COVID fatigue right now?
I think the biggest thing is, number one, do things that make you happy. Read a book. Take some time to go out and play with your children. Take some time to go play with your pet if you don't have children. stop what they are coining the phrase doom scrolling. I don't know if you've heard that, Adam.
I'm guilty of it.
But there's a lot of individuals who do that. They get on their devices, whether it be their phones, whether it be their computers, laptops, whatever it might be, and they scroll through all of the COVID information. Some information is good out there, some information is not so good out there. And it's difficult to weed through everything that's out there. I can tell you myself, when I go home in the evening, the last thing I want to do is turn on the TV and hear the media and the news reports about COVID, because that's all we've heard for over a year now is COVID. And sometimes individuals need to just take a break from that and back off of that. Individuals need to take a break from social media. And it's just, again, I think that's a form of doom scrolling when you start to just kind of chat through social networks about what's going on with COVID-19. So you need to kind of disconnect. You need to disconnect, and you need to get back to your inner self, and you need to look to see what makes you happy, whether it be, doing an exercise routine in your own home. I know a lot of folks are still dealing with gyms, for example, not being open, or they're being open on a limited basis with restrictions. Create areas in your own home where you can do exercise. Go outside. And that seemed to be a big helpful thing last year during 2020. RV sales were up. VRBO and Airbnb rentals were up because folks were getting out. They were still trying to do things, but they were trying to do them safely, and they were trying to do them in their own immediate family groups. So exercise is always good. And the reason it is because when we are exercising, the endorphins in our body increase. And endorphins are just our natural antidepressants. They help to kind of ward off the depression for us. So exercise is always a great thing. Practicing what we call mindfulness, which is just cultivating an awareness of what's going on in your own world now, not worrying about what happened before, not worrying about what's going to happen in the future, looking around and appreciating what you truly have in the here and now. And that's known as mindfulness. Expressing yourself in some way, whether it be you express yourself in a journal and write your thoughts down, whether you're a musician and you express yourself through music, or whether you're that dancer and you're trying to express yourself through dance. It's just a way, it's an emotional outlet for individuals. Watching things on television or on streaming sites that you enjoy. Watch a movie, for example. Something that is not going to tax your mind, and something that's going to provide you diversion of some sort. Meditation, yoga, these are all excellent ways of diverting away from the pandemic and allowing you to relax and de-stress and disconnect, but still try and get in touch with yourself.
Yeah. I'm certainly grateful for outdoor opportunities in particular, speaking from my own personal experience in the past year, just that thankfully the pandemic didn't totally change that in a lot of ways. Certainly social distancing guidelines in different places had to be followed, but I'm really grateful that, the threat wasn't as potent out in the world, out in the woods or out along the river or something like that.
Mm-hmm. And like I said, a lot of folks have gone out and purchased RVs. Yeah. And they have found that being out communing with nature and still having all the comforts of home per se has really helped to kind of de-stress for people.
We need to take a quick break from this conversation. While you're waiting, this is the perfect time to follow Diamond on social media. You can find us on Twitter, LinkedIn, and YouTube. And if you're local to our Indiana, Pennsylvania headquarters, you might like to follow our Facebook and Instagram pages for our Diamond drugs and medical supply stores. We welcome your likes, shares, retweets, and comments on all platforms. And now, back to the show.
Now, moving away from sort of the population at large and moving more into your professional focus. So, of course, healthcare workers, we can't not talk about healthcare workers and their experiences with pandemic fatigue. They, of course, this is a different level of experience with this phenomenon. As someone who works in healthcare and is very much on the front lines of the pandemic, what is your advice to those workers in particular who are struggling with COVID fatigue?
Well, I'll tell you what, my heart goes out to any healthcare worker who's been on the front lines because of the fact that they never get a break. They've not gotten a break in over a year. I mean, early on in the pandemic, and as the numbers rose, November, December, into January, it is very difficult to try and separate yourself if you're a healthcare worker from what you're doing in that role, and then trying to go home and be a wife or a mother and take care of things at home or be that father at home. Healthcare workers have really not gotten a break through this entire pandemic. They have been on the front lines. They've been dealing with the illness. They've been dealing with the COVID. They've been dealing with a lot of death if they've been frontline kind of workers. And we as human beings are not programmed to deal with death after death after death after death, day in and day out. So, healthcare workers really need to be able to have that break away from work and walk that fine line between work and just having that downtime and being able to participate in activities where they can regenerate and they can rejuvenate and they can renew so that the next day they can go back into the workplace and start all over again. Because we've seen a lot of COVID fatigue in healthcare workers and in frontline workers because of so much that they have had to deal with over such a prolonged period of time.
You're most familiar with long-term care workers, especially given your work here at Diamond. As far as that goes, given that that's an industry that's prone to staffing shortages, are those folks able to get that time away to rejuvenate and deal with the fatigue?
I think it's very difficult for a long-term care worker to be able to do that, Adam. And it's simply due to the fact that all healthcare workers, irregardless of whether you're acute care or long-term care, they're working long hours. They're working overtime. They're working days off. We're not in this business because of the glorified positions we're in. We're in this business because we care. We're caring individuals. We're compassionate people, and we want to help individuals. So a lot of times, healthcare workers, long-term care healthcare workers, they're in there for long hours, so they don't get the break that, an individual who's in a non-healthcare related field is. And they are dealing with this day in and day out. And really, when you think about it, the pandemic is like going to war.
Yeah.
It's no different than that soldier who is on a battlefield. The difference is that soldier is that nurse or that frontline worker, and your battlefield is that long-term care facility you might be working in, or that hospital you might be working in, or that ambulance that you are an employee of, and you're transporting a COVID resident or a COVID patient to the hospital. So it's like a war. And when you're dealing with war, you are going to deal with a lot of post-stress issues after that war. So with the long-term care, not only is that individual having to deal with what they're dealing with internally, but in long-term care across the nation, most of the long-term care facilities have been closed to families, friends, and visitors. So those healthcare workers are now the family, friends, and visitors of those who reside there. So there's that added level of responsibility for that healthcare worker now, because if you've got that elderly person who's sitting there and the only person they see every day is you're their family now.
Yeah.
And you're all in this together. And I think that's what I've seen, with the healthcare, with the long-term care industry, is that it has bonded not only employees but residents together, and it's brought them into being one complete family wherever they work.
Yeah, certainly. Certainly there's been plenty of news stories out there where you see family being able to look through the glass at their loved ones, but that more personal interaction,
right.
The healthcare workers have to step up and do that as well.
And I just know from experience from being a family member, my father had broken his hip last summer, and he was a resident of a long-term care facility locally for a period of time. And, I know the frustration I felt not being able to go in and not being the supportive daughter that I would have liked to have been at his time of need. And I do remember going to the window of his room every day and talking a few minutes with a facility provided cell phone to him every day while he was in there. But a lot of times, too, the residents, what they're seeing when staff goes in is staff that has personal protective equipment on. They're not seeing just a human being walking in the door. They're actually seeing a human being who pretty much looks like a space cadet because they've got their gowns on, they've got their gloves on, they've got their goggles on, whatever they need in order to protect themselves. So to some degree, that makes that resident of a long-term care facility feel like a leper. So then they're dealing with a lot of issues and emotions and themselves. So the healthcare worker, in addition to being family, is also kind of like your pseudo-psychologist to some degree in providing that support system to that individual as well.
Yeah, the fatigue is just so complex, just how it affects everyone differently, but profoundly differently in in those cases.
Thanks for listening to PodcastRx from Diamond Pharmacy Services. If you're a fan of the show and have any topics you'd like to hear us discuss, or if you have any thoughts on a particular episode you'd like to share, please email us at podcastrx@diamondpharmacy.com. And while you're at it, please rate and review our show wherever you get your podcasts. Your feedback helps us make the best show possible for you. And as always, we appreciate your feedback and support. Now back to the show.
Moving back to your job in infection control, are you seeing fatigue manifesting in ways where people are just tired of the constant vigilance, whether it's be the mask wearing, the hand washing, following procedures? Are you seeing more of that now that we're almost a year into this?
I am seeing some of that, yes. I do a lot of surveillance. I do a lot of walkarounds. I'm constantly talking to employees here I'm observing that they're adhering to what we as a company are asking them to do. And just through discussion and observation, I'm seeing more of this COVID fatigue. People are tired of wearing the masks. So sometimes you walk around, you see where the mask might be down beneath the nose, for example, or it's completely off. People are tired of having to distance from each other. People are tired of not being able to socialize the way they used to in the break rooms, because in our break rooms, we have made adjustments so that people are not sitting side by side, for example. They're sitting 6 feet apart from each other. And we've moved individuals around who continue to work in our pharmacy so that they are apart from each other at a distance. And we've cubicled individuals and we've compartmentalized individuals. So, and people are just getting tired of it.
Understandably so.
People, like I said, want to return to some semblance of normalcy. And we're not to that point yet. We're seeing some glimmer since we do have access to the COVID vaccines that are out there currently. So there is that glimmer of hope, but we still have a long, long way to go.
Well, let's get into an optimistic area then. Let's talk about that light at the end of the tunnel. So now that the vaccine rollout is well underway, what do you think? You talked a little bit about this earlier about things going into 2022, 2023, but what is the realistic timeline to when we get back to quote unquote normal? I mean, what is normal now anyway?
I think realistically, we're probably looking at the end of 2021, early to spring of 2022 at this point in time, before we can actually start having family gatherings, before we can start, releasing some of the use of masks to some degree, before we can start actually hugging people outside of our own immediate family. And, we continue until then. We need to continue with our mitigation efforts. Just because the vaccine is out there, it's still going to take a long time until we can feel comfortable to get back to some normalcy. There's a lot of vaccine that is out there and becoming available, but accessing it and getting shots into arms, as they say, has been a slow process. So it's going to take time. Experts are predicting anywhere from, in order to get that herd immunity, that we are going to have, depending upon the expert that you listen to, we are going to have anywhere from 70 to approximately 85% of individuals who get that shot in the arm to get the herd immunity, to get us to the point where we can start relaxing some of the restrictions that we have now, and we can start returning back to some sense of normalcy. But, in today's world, for most of us, this is the first pandemic we've ever dealt with. Mm-hmm. There's been some pretty catastrophic pandemics in the early 1900s, for example, and we had, SARS and we had MERS and we had some of the others, but they were not in our own backyard like COVID-19 has been. So this truly, for a lot of folks, is the first pandemic that they have dealt with. So nothing is normal right now, and it's going to take some time to return back to some sense of normalcy. But I don't think we're ever going to get back to pre-pandemic normal. It'll be a new normal.
Right. Just to add to that, I saw that the New York Times this morning had an article that the phrase "not zero but normalcy" that was mentioned. And just basically, in other words, we're never going to eliminate this COVID-19 risk completely, but at least the measures we're taking hopefully will get back to that, closer to that normalcy that you talked about.
Well, I think they're hoping that, once we do have that herd immunity, that the COVID-19 will be no different than the common flu, for example, or no different than some of the other viruses that we deal with, that there's going to be enough immunity out there that, yes, we will continue to have folks who might get it, but the numbers won't be as great as we've seen in the pandemic, nor will the severity of disease be as great as what we've seen in the pandemic.
On top of that, do you think that even as we get back to that redefined sense of normal, but as close to normal as we had prior to the pandemic, that any of the pandemic protocols that we're so used to now, whether that's mask wearing, working from home, those are going to stick around even after public health officials have more or less said, okay, well, we're back to normal, quote unquote. Do you think those things will still be sticking around en masse?
I think we will continue to see some things. I'm not sure if we will see the mask use because of the fact that people just are social human beings. We like to smile at folks. We like to use facial expressions. And when you have that mask on, that makes it so much more difficult to do that. So we may not see the mask use, but some of the other things that are in place, they may continue on. You mentioned working at home. It has been successful in a lot of workplaces. And I think that we will continue to see a certain percentage of companies out there that will continue to allow employees to work from home. I know that's certainly something that this organization is looking into, is allowing employees to work from home. Now, of course, you have to look at the individual employee when you're looking at that, because you have to look at, is it something that the employee emotionally and psychologically can handle? Because that's difficult. I've had conversations with employees who say, hey, I love working from home. It's great. I can sit in my pajamas. I don't have to worry about driving in the snow or the winter elements or anything like that. And then there's other employees who feel so isolative because they're working from home. So I think you have to look at it on a case-by-case employee basis. There still will continue to be, employees working from home. And I think companies are looking at it from a financial standpoint, too, because of the fact that it's more cost-effective, oftentimes, to allow employees to work from home. So you'll still see a certain percentage of employees working from home. You may still continue to see some physical distancing that will linger on, as we continue to work through variants and unknown variants that may arise in the future. So you're still going to continue to see some distancing to some degree. I would hope that any infection control measures that businesses and organizations have put into place because of the pandemic will stay, because they've been good things. It's good to have increased infection control. It's good to have increased surveillance of what you are doing in the workplace with respect to infection control and what your employees are doing as well. So I would hope that would be a good, positive thing that comes out of that. So a lot of the mitigation efforts that we already have in place, I would think we are going to continue to have, but maybe to a lesser degree.
Now, you did mention at the top of our discussion about that some real serious changes had to be made for us to get back to that baseline, or normal, to use the dreaded phrase. Were some of what you just talked about, were those some of the changes you were alluding to, or were there others that you had in mind?
I think that the basic changes, number one, are we need to really get people on board with the vaccine. Okay, that's the first change that has to happen, is that we have to have enough individuals who are willing to go ahead and get the vaccine. And up till this point, we've seen that that is not happening to the level that I think was anticipated initially. And, I can make point here with the fact that when we look at vaccinating long-term care residents, where a lot of COVID has occurred, where there's been a lot of deaths because of just the population group that is being cared for at that level, there have been more individuals who reside in long-term care facilities who have been vaccinated versus the healthcare workers that are taking care of them. If you're looking at the general population outside of healthcare, you're seeing a lot of older individuals clamoring to find a vaccine to protect themselves, but you're not seeing that with other age groups at this point in time. There's a certain percentage of people who are kind of wanting to step back and see how the vaccine plays out for those who have gotten it. I jokingly say that when I got my first vaccine, one of the employees that I supervised said to me, "Well, I see you didn't grow an extra leg or arm." So I think that's the mindset that a lot of people are taking. They're thinking that perhaps this vaccine rolled out too quickly, and they're afraid that down the road there's going to be some type of adverse reaction that was unanticipated. So I think that's the first step, is making sure that we are getting the information out there, we're getting accurate information, and we're giving the public everything they need in order to make an informed and accurate decision on getting the vaccine. And I think that's the attempt right now by the government as well, since President Biden came into office, is just getting the vaccine out there. Definitely trying to work with media outlets to ensure that the information is accurate as well, because there's so much misinformation out there right now.
Yeah.
Working with individuals to continue the mitigation efforts that we have in place, because those need to continue. I know I have fielded questions from individuals who have gotten the vaccine already, who have asked things like, okay, I got my 2 vaccines. Do I still need to wear a mask? Yes, you still do need to wear a mask. Even though the vaccine has come out and it's designed to protect you, and it has shown to also provide protection to others who are around you, we don't have enough people vaccinated at this point in time to say, yeah, you can take that mask off. Yes, you can give somebody who is not part of your household a hug. We're not to that level yet. So anything that we had in place pre-pandemic, at the beginning of the pandemic, continues to need to be done at this point in time. The vaccine is the primary thing right now.
Right. And as long as we all adopt those mitigation measures, the faster everyone is to adopt them, the faster we can get through this, and the faster we can be relieved of the COVID fatigue.
Yes, that is true.
Debbie, I want to thank you so much for joining us again. This has been a really, I'm always bad at ending these because I do them so off the cuff. Debbie, I want to thank you for joining us again to talk about COVID fatigue. And here's hoping that the rest of the year is not quite as eventful as 2020 was.
Well, thank you, Adam. I have been COVID fatigued myself, as many other individuals have been. Being an infection control coordinator for the organization is difficult. Trying to keep people safe and healthy has been difficult, and just trying to ensure that our employees have the accurate information, as well as our customers have the accurate information, and provide the resources that everybody needs in order to stay safe and healthy.
Well, we certainly appreciate your effort on our behalf as employees and on behalf of the customers. So thank you and the COVID task force for everything you've been doing.
Thank you, Adam. Much appreciated.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.
Music in this episode by Wolfgang Worley. Sound expressed by Getty Images. Additional music by Maximiliano Silvera. Sound expressed by Getty Images, the 126ers, and Silent Partner.